Hey you! Did you know you can get tested and treated of STIs free of charge here at Chant Wellness Center? Come, I'll show you how easy it is. The first stop is the reception. The team here is super friendly. Once you check in, we chill a bit and then we roll. You need to talk? The counselor's got you. No judgment, all ears. It's safe, it's private, it's for you. Vitals, they are quick and painless. Testing time, HIV, STIs, all done right here. Fast and free, no long waits and no drama. And if you need treatment, the doctors handle it with care, privacy and real talk. It's free, it's friendly. No stress, no shame. Chant Wellness Center is your spot. Pull up, we got you.
My friends, my name is Mr.Selfcare, your host of your favorite program every Wednesday 9:30. We're in partnership with AHF Uganda Cares, your #1 stop healthcare facility when it comes to sexual and reproductive issues. I once again welcome you this week for yet another conversation as we commemorate the International Women's Day. And I have an interesting story to tell you. Do you know that 90% of people who watch this channel actually have not yet subscribed? Please, if you're a person watching in, a friend that is just visiting for the very first time, and you find data or information shared on this page very useful, I kindly ask you to subscribe, comment, and share, because this is one way we make the channel grow very fast, but also make YouTube recommend it to a number of YouTube users to carry this information far and forward and beyond borders. Let's start here. Women are at the heart of Uganda's fight against HIV. They are caregivers, leaders, advocates, and change makers in their families, communities, and the nation at large. Unfortunately, many women, both living with HIV and those that are just affected by HIV, face challenges ranging from stigma, discrimination, to limited access to health care, mentorship, and leadership opportunities. Today, we are honored to host two inspiring women who are driving change among the so many women in the country or in the world at large. And that is Ms. Chomukama Flavia, the Executive Director of NAFOPHANU. She's going to tell us what that means. A champion for women living with HIV and an advocate for their rights. On the other side, we are going to have Ms. Jimbo Shanura, a Girls Act leader. Also, Miss Y+. She will tell us what that means. She's been at the forefront of empowering young women to take leadership and to create impact in their community. Together, we are going to explore the realities, challenges, opportunities for women living with and those that are affected by HIV. We are going to hear inspiring stories. We are going to discuss empowerment. We are going to see how the support they have gotten from organizations like AHF and other organizations that are helping people with and without HIV across different communities in Uganda have impacted the women out there. But also, we are going to discuss the general global contribution of women in the fight against HIV. This is a conversation that is about hope, courage, and action. Because when women are empowered, trust me, communities thrive and Uganda eventually wins. And the vision 2030 becomes actually more realistic. Join me in having this conversation with these amazing ladies and women that we are going to have today. Let me start with the young one. Jimbo, you're welcome. Unmute yourself and speak to us.
Okay, thank you very much, Mr. Selfcare, for inviting me today. I'm
Yes.
really honored to be on this platform to share my insights on this Women's celebration, specifically in this month, but as well as community experience when it comes to women and HIV, and what we can do as a community to make sure that we reduce the prevalence in women and girls, but as well as help the whole Uganda at large. Thank you very much.
You're welcome. In a minute, what is Miss? What is Miss Y plus? What does it mean?
Well, Miss Y Plus means a national representative with the
Mm,
Uganda network of young people living
mm,
with HIV in Uganda. But as well as I'm here in the capacity of a Girls Act leader
mm,
with AHF Uganda Cares,
mm,
which is a program aimed at prevention. So we have a lot of girls in different groups. For example, we name them as chapters. We
mm,
have a chapter in Mulago, a chapter in Kamocha,
mm,
Lukaya, Soroti. So these girls, like me, are champions of
mm,
change, going around to spread awareness on HIV prevention, to end
mm.
stigma, and also information about sexual reproductive health and rights. As
Okay.
well, I
Yes.
am here also in a capacity representing adolescent girls and young women as the chairperson of the Adolescent Girls and Young Women
Mm.
Forum of Uganda and a youth advisory board member of the She Souls project. So, Jimbo Shanura is a youth advocate and a national representative for adolescent girls and young women. I'm honored to represent their voices today. Thank you.
Wow, that's big. I mean, you're seated in so many seats, and I think stepping in a lot of big issues. Yes, Flavia,
Apologies, my voice may not be very clear. I have a very bad flu. You
you're
see, I'm
still
even covered
sounding
up.
perfect. Perfect.
Oh, thank you. Thank you.
Flavia, we are glad to
So,
have you here. Who
thank
is
you.
Chomukama Flavia? I've heard this name today when I was typing in. I couldn't read the literature that is written below that name. Who is Flavia Chomukama and what does she do in Uganda? Why are you so famous? And tell us about that noble organization in a minute as we start the conversation.
Well, thank you so much, Mr. Selfcare. I'm Chomkama Flavia, and I am the Executive Director of the National Forum of People Living with HIV Networks in Uganda.
Mm,
And this NAFOPHANU, in short, the one you are asking, is a national coordinating organization, non-governmental, that started in 2003 to
mm,
coordinate networks of people living with HIV. So
mm,
since 2003, we coordinate 18 national networks, and those national networks include those of women, girls, teachers, men, home-based carers. We
mm.
have religious leaders. We have the ANARI, people in uniform, people with disabilities. So we have young people represented. We have teachers represented. We have also 135 district forums of people living with HIV, and these ones are working at the district level.
Okay. Okay.
Apologies.
Yes, please. Okay, you're muted, Flavia.
I'm tethering from my phone, so somehow it's dropping off a bit. So we coordinate 135 district forums of people living with HIV
Mm,
networks, and we also coordinate 10 city forums. And these forums and national networks and the city and district, they are all constituted of networks, support groups, associations, groups of people living with HIV found in Uganda. We also align with a global network of people living with HIV, which is our national umbrella that supports across the world in technical support and other related capacity building in light of living with HIV, but also engaging partners and ensuring that the HIV response is managed. I also sit on the National Committee of Technical Experts at the Uganda AIDS Commission, and I also represent African patients in the International Alliance of Patients Organizations, IAPO board, and I am the treasurer. So I have lots of hats, and I would like to say that this Flavia is a teacher by profession, and so she has worked in government. I've worked with UNESCO in Mozambique for 2 years. I've come back, I've joined civil society, and along the way, I have worked with people with disabilities, particularly children, parents and children living with disability, living with HIV. I worked with the youth when I was in Mozambique and engaging in HIV prevention. I have worked with women under the Global Coalition. I worked with women under the movement of women living with HIV in Uganda. And I have worked for health financing in my previous role at the Action Group for Health, Human Rights and HIV, and currently I am coordinating the people living with HIV networks in Uganda. There is so much I've done. I was a manager for the first people living with HIV owned telephone helpline called Support on AIDS and Lives with Telephone Helpline. Yeah, so that is a little bit. I've also been on various researches for PMTCT 1994. When I discovered I was enrolled on that first groundbreaking research, I was part of the development of antiretroviral treatment, and successfully, we religiously were research respondents, and we were able to demonstrate that Africans can take ARVs. And then I was also part of the people who have been advocating for cervical cancer because I had cervical cancer. I go to surgery. So it's a lot of things
Wow.
that I've been the
Flavia,
experiences.
we need to have we need to have a one-on-one to have more
Thank you.
of this. So people who are tired. I mean, you do one class and you're tired of school. You now understand what a CV means. Now imagine you're competing with Flavia, whose CV can't fit on a documentary, and for you have one paper, and you're shouting how school is hard. Let me start with Jimbo. Jimbo, can you share with us the current situation of young women living with HIV in Uganda, and what are the current what are the biggest challenges they face today?
Thank you so much for that question. The current status of young women living with HIV in Uganda is really so complicated that we cannot just write it on paper. It comes in a way that we shifted from just identifying young women living with HIV as just girls or young women, but this time round we have young women living with HIV and they are having disabilities. We are having young women living with HIV and they're in schools. We have mothers. We have teenage mothers as well. We have those out of school. So basically, right now in Uganda, the status of adolescent girls and young women living with HIV is broad, but as well as they are the largest population of people living with HIV in Uganda. Uganda right now has a population of over 1.5 million people living with HIV. But then it is so shocking that as of 2024, out of those 1.4 by then, over 886,000 were women, and then 86,000 were children, which means that even there are some of those adolescent girls and young women who are not into care. So we are having that kind of percentage, plus there is a gap in identifying and linkage of these girls from the community to the health services. So that intersectionality that we have today is what I can tell you as the status of young women and girls in Uganda who are living with HIV. Thank you.
Wow. It is that it is that big. Flavia, in addition to what in addition to the youth challenges that have been mentioned by Jimbo, can you share the current situation of women living with HIV in Uganda? And according to you, that has represented, sat on so many panel, traveled in almost all parts of the country. Generally, what are other challenges that women face today when it comes to HIV? Those living with HIV, but also those that have been affected by HIV. I mean, people who have lost husbands and like that. And also, don't forget to include our sisters who are involved in risky behaviors when we are talking about HIV.
Okay. Thank you very much, Mr. Selfcare and Jimbo, for that precursor. In Uganda, the issues of women are immense. And I would start by saying that the structural challenges in light of accessing services, in light of the law, in light of complacency and normalizing violations, normalizing access to service. And right now, what is significant and I would like to talk about is the current funding cuts. And I also want to talk about the integration that recently happened. We do understand that the closure of the HIV and TB clinics in the country, and I think globally, has had a significant impact, particularly to women and girls living with HIV and the affected populations. We do also understand that the funding cuts have declared that certain gender will not be recognized. And some of them, the female sex workers, the lesbians, transgender, which are they look male, some of them, but they are actually of feminine nature. But ideally, the challenge is that when integration happened, we were used to getting our medication from the closer to home, and that one has since closed. It means that we have to look for resources as women living with HIV and our families to reach the public health facilities. And the distance radius is about 5 to 10 kilometers or even more. If you are going to the islands, if you are going to the hills, it's even longer than 5 kilometers radius. So access to HIV treatment, access to the law when abused, the violations that continue to happen against women and girls. And I would like to cite defilement, and I will link it to the current new HIV infections. So we have, as of the 2024 police crime report, indicated that 11,000 adolescents and young people had been defiled. But of these, maybe about 3% had reported. But when you corroborate it with the current new HIV infections among adolescents and young people, which is 14,000, and of these 11,000 are adolescent girls and young women, it becomes a big problem. So you link the defilement, people as a country who have not put in place redress systems that are deterrent to defilement, that are deterrent to sexual gender-based violence. The laws are there, but enforcement is still very limited. So it creates a problem also that we are having a big proportion of Ugandan women not educated. About 73% of the population has not reached high school. So it means that information and awareness is limited because the channels of information, the radios, the newspapers, the social media, then they may not be able to afford or even to utilize those services. So we still continue to grapple with the poverty, that to go to the facility, you need to get resources to reach. And I want to highlight that the women in this country, women and girls living with HIV and their families, continue to carry and bear the brunt of the HIV epidemic. We are caring for our babies, the 4,700 babies who are being born with HIV annually. As of last year, about 4,700. And we are also grappling with the high number of new infections of 3,700. I know it has declined over the last 10 years, but for me, in absolute numbers, having babies born with HIV who are 4,700 puts a very big burden and a big caring role on the women to ensure that they live longer taking medication, as well as ensure that their babies are taken for early checkups, They are supported to take the treatment. And then on top of that, during this last year, we have had consistent stockouts. And of course, when there are stockouts, the people who are able to buy are not the women. They are those who have the money, the other gender. And if you are lucky, you have a partner who is able to afford to go and get it for you, or pay transport to go to a facility further and get the kind of drug you require. That would be luck. But many, whenever they are stockouts, they call us and they say, we are having stockouts of TB, pediatric TB treatment, pediatric ARVs. We are also having consistent stockout of second and third line. At one time, we did not have a third line at all around June, July, August last year. We had deliveries or purchases by the ministry around September. And so there has been this structurally mainly affects the women, because when they don't get the drugs, they don't have an alternative. And they would have to move to the facility every other week or every other 2 weeks to go and pick the medication. That is transport. Money to reach the facility to get for 2 weeks or 1 week, and then they have to go. And we know that we don't even have resources. And then the other challenge we have had is that most of the community health workforce, which was of people living with HIV, was mainly women. And we were driven by the passion, the fact that we are bred and produced as carers. And the funding cuts started with the community health workers. And I think in Uganda, we lost about the community health workers who are supported by government, by USG, were about 8,000, or the total was about 8,400. And all those lost jobs, right? So they have to re-engineer themselves to see what to do to ensure they have a livelihood. And in addition to the caring role, this is really debilitating. It was a big shock. It's so disrupting. We have had that kind of engagement. And we have also learned, today we were in a meeting and we were told that the comprehensive HIV information among women is about, we have a gap of about 36%. People who are women who don't have comprehensive education around HIV. So it becomes problematic to manage HIV among women if they don't even have the information. And that goes without saying that the stigma and discrimination that continues to be in the households, in the health facilities, in our community structures, like our norms, cultural norms, our religious institutions, they continue to hurt the women, and the women living with HIV are caught in the web of stigma. And finally, the other challenge we are having is that we have got over the last 18 months, and this is not only for the women, we have lost about 15 or so people living with HIV leaders from the districts. And they are dying of non-communicable diseases. And the implications of some of these drugs, long-term use of the drug, long-term use of ARVs, long-term survival with HIV, long-term, and now aging. It's another critical factor. So that's why we're seeing lots of cancers. We are also seeing a lot of mental health issues. And that notwithstanding, the increasing death of people living with HIV leadership, including the women. The majority are men, and we are thinking of doing a simple survey to see what could be triggering all this. But we know a little bit that non-communicable diseases are on the rise, and we have had diabetes, we have had asthma, we have had, across a spectrum of non-communicable diseases. So the women and girls in this country continue to bear the brunt and the burden of HIV. And of the 1.5, I will re-echo that about 58% are women. And then when you add on that about 0.4% who are babies, the babies are us. We carry them all through. And then adolescents and young people are about 76 something thousand. They are also around 76,000. They are also our responsibility. We know the men are supporting us, but the big burden of care rests on the woman. And we have not provided caring labor We have not evaluated the caring labor as women living with HIV and affected communities. But finally, a greatest percentage of our female sex workers, we did realize that they have a very high HIV prevalence, about 37. I think that's what I heard today. You need to cross-check that. And they are illegal. They are arrested every other day. They are thrown in prison. Sometimes they have to pay. If you read HIRAF reports, they have to pay with the sex to get bond, police bond. They have to pay, and they are getting HIV as well as those who get. When they are condom stockouts, they are not protected really. And then with the
Wow.
violence that comes with sex work, which is criminalized, becomes very difficult to manage because they keep running. And the law is arresting mainly the women and limited targeting to the people who buy. And we know this, we have done home site visits and we have seen, but when the police come, they arrest women. They never pick the men. So you are already at the receiving end of the law. You are already at the receiving end of a community that has normalized violence. You are at the receiving end of a society that looks at women as less equal and less privileged. And now we see funding cutting off even the little we have been getting. And as I speak now, the National Forum of People Living with HIV does not have a secretariat. We had to leave the home and we cannot afford rent. So we are actually fundraising to have a secretariat to ensure that we sit and coordinate better, monitor the stockhouse, monitor the quality of services, monitor the caring labor and the care support that we are offering that is never recognized. We are even struggling to engage the USG and the Ministry of Health to say, where is it? What is it we are going to do? We have been partners in all the HIV response over the early years. But today, the general population of people living with HIV and civil society are struggling to see how do we fit into the new funding architecture of the USG. And we are also engaging the global fund writing. I didn't say that I sit on the CCM and represent non-government organizations, but we need to see how we can finance organizations of people living with HIV and especially the support groups and associations and networks of women and the others, because we have been at the community, we have provided the passionate support, treatment literacy, psychosocial support, we provide home-based care, we visit, we do directly observe who is
Okay. Yes, Jimbo. I think Flavia is having a network glitch while we wait for her. To everyone watching in, this is why we need to advocate for more funding in HIV for people who do not know the impact that we got when we had cuts from USAID, when we had actually financial cuts from USAID, and people are saying, oh, we don't see the effect. The effects are huge and happening. You've had the numbers of people in thousands who lost jobs, who are only working in HIV-related organizations. So we need to have more stakeholders to make sure we reestablish this funding to bridge the gaps that have started existing. Miss Y Plus, Jimbo, Flavia has highlighted a lot of things, especially financial cuts and all that. How are young people? Let's talk about accessibility of HIV-related services. How are the young people coping up today? Who is helping to bridge that gap that was left by the funding gaps? How are you coping up? How are organizations like AHF Uganda and other organizations actually helping out to make sure that at least there is still accessibility and actual affordability?
Okay, thank you very much for that wonderful question. This funding issue has come at a point where our government is not able to support people, especially in the health sector, because I feel like as a country, we have not made up to the commitments. For example, the Abuja Declaration, we are below 5%. So this funding cut, it coming, has hit a very huge blow, and it is non-discriminatory on the effects that people are facing. And this includes the young people who are living with HIV today. So it came in a way that medication was not available because it was being bought by money, as Madame Flavia has explained. It came at a point where there are many programs, not only about treatment and support, but also about HIV awareness. And many young people who are living with HIV were benefiting from these specific opportunities. For example, the OVC, we very well know that many young girls living with HIV are very much prone to being orphans. So there was that funding coming in, supporting them on education. There were a lot of things, the YAPs, those adolescents who are working in those different health facilities. And when this wave came, it actually blew them away from the support that they were getting, not only the treatment. But then, as a community, as human beings, we have to adapt. So, different civil society members, plus the government itself, have been having discussions on what are we going to do as a country to make sure that these young people stay on treatment, because it was a challenge when funding was there, but then right now when there is no funding to follow up, what are we going to do? So there has been discussions together with AHF Uganda Cares, the Ministry of Health, TASO, and integration has come up as a solution. I believe that Madame Flavia mentioned about it, where we now moved the ART services into the mainstream um, health facility services. It's no longer a stand-alone art clinic, but today people are getting services within. But as well, this is not enough. As you very well know, HIV is not only about treatment, it's about psychosocial support, it's about community transforming minds of people. And AHF, together with the Girls Act program, the Boys to Men, have found ways on how to support the government, because we are in Kampala, we are in Soroti, we are in Lukaya, but those Girls Act leaders follow up on those adolescent girls in their different communities to find out, are they taking their treatment? Those who are lost, to follow up, how can we bring them back to the what? To the health facility. But something that is unique is that though the YAPs have been cut off, at AHF the YAPs are still there, which I
Oh,
think they deserve an applause on that, making sure that young people are still in the system, but as well providing funding together with their other CSOs to see that they can support the government, influence the global fund funding mechanism, that round which happens, to make sure that the government can actually contribute money, and also Uganda can benefit from the global fund pool. Yeah, that's what
yes,
Uganda is
Flavia. Simply before, Jimbo, simply before I go back to Flavia,
doing.
the times have been at AHF, everyone is talking about youth-friendly services. Just in 30 seconds, how youth-friendly is as HIV services at AHF Uganda Cares?
Well, youth friendliness is a term that has been used a lot by many people, but to me, it is a groupage. It is, it has accessibility of the health facility itself, but not only accessibility of that youth corner. Okay, youth corners can be built, they can be tagged as young people's corners, but then are they accessible? So if the youth corners, for example, at AHF are accessible, can the young people access the services they have come to get? Because they can come for ART treatment, they can come for STI treatment, they can come for just counseling. So can those services be accessed? And also it has reception. At AHF, that's where the youth the young adolescent peer supporters coming and the counselors. Yes, the services are there, but is there someone who can build rapport with these young people to make sure that they can break down the reason as to why they can come? Many young people come for STI screening, but they be like, I want Panado. But is there that young person to have a conversation with them? So Girls Act leaders are there, the health facility, though they are not stationed there, but they are there, and also the YAPs to make sure that these young people say what they want and get it. Also, one key issue on youth-friendly services that is at AHF is the confidentiality. We find that many people do not go back to the health facilities that they get services from, just because everyone at that health facility knows that this young person has this STI, they were maybe defiled. So we have confidentiality. I think it has also been integrated in the new wellness clinics that have come up. So youth friendly services also have linkage. It does not only start at the health facility. The Girls Act leaders and the boys to men link these young people and make sure that they get the services at the health facility. And also, youth friendly
Yes.
services have a concept of doctor patient rapport. So to me, it is not just a word, it has structure, it has people, it has the service
Yes.
itself, it has healing linkage. Yes,
Yes, Jimbo.
thank you.
Again, answer this at what you fit so many shoes. I mean, your Miss Y Plus, you're representing the young people on so many platforms. Here comes my favorite question that I normally people that come on this panel. As a young leader, how have you used your leadership position to empower other young women to become
Mm.
leaders and advocates in their communities? Because I think this is Uganda has had so many of these programs, so many people becoming leaders in different capacity. But how have you used your position? I've seen the Miss Y Plus, I've seen you on platforms. How are you using your position to empower other young people and to develop more leaders like you?
Well, thank you very much for that wonderful question. And thank you very much for that question, by the way, because I believe whoever is listening to me can understand the power they have as a leader. And it's not just a title, it is what you bring to the table, like the service that you give to the people that you are representing. So, as a Girls Act leader in that capacity, I train a lot of adolescent girls and young women about confidence, first of all, because in the community we have a lot of power dynamics. But I make sure that these young people know that, yes, you are a girl and you are in this household, you are not economically well, you are still studying, but yes, you can make it. So I make sure that I instill confidence in these girls, tell them to stay in school, because as a leader you need knowledge, and as a young person school is the right place where you can get that knowledge. So in my capacity as a girls art leader, I have provided information to different girls, but then as the Miss Y Plus, I also attend webinars where I share information on how young people can run their networks in, because the Uganda network has networks in Gulu, has networks in Jinja, but then how can we work together to make sure that we reach the young person living with HIV on the ground, and we talk about the programs and make sure that young people are meaningfully involved. So in a meeting, I make sure that we have that young person in Ginger who is affected on call to make sure that they respond to the challenges that they are facing. If I if if an ED is there, can they respond to the challenges? So as a young leader in that capacity, I make sure that I mobilize others. But as well as a youth advisory board member for the She Souls project, wherever I go, I make sure that I talk about intersectionality, influence policies like the national child participation policy, the national framework on education, health, and life skills, because we speak, we be in the community, but policy is everything when it comes to implementation and making sure that the government provides the services that these young people need. So in my capacity, I make sure that I coordinate with other young people, mobilize, teach, confidence, inspire as well, to make sure that
Yes,
everyone joins leadership, and as well as they're impacted by my leadership.
yes, Jimbo. Let me pause it there. Again, I want to thank my programmer Bridget and Diana for Bridget, Diana, and Martha, and the team at AHF for my guest today. I'm inspired. I'm enjoying the show. To everyone watching in, don't lose a minute of the show. And again, like I say, the Wednesday shows are for your whole family. We use language that is sensitive to young people. And again, I say, you may watch this alone and your girl is suffering in the bedroom. Share this right now. Share it with men. Men don't want to watch this thing. I know they want to watch Arsenal and Real Madrid a few minutes from now. Force them, invite them, watch with them. But again, I ask you, if you've not subscribed, to subscribe. Each subscription you make makes YouTube to push this video to all the people that you subscribe to. So one subscription adds a lot to our community. We want to inform, we want to empower. Again, I thank AHF Uganda for partnering with us and all the funders and donors at AHF. Thank you so much. Flavia, back to you. We were still talking and we got a network
Yes.
glitch. Flavia, how does NAFOPHANU, that is the organization for women, I think, with HIV in Uganda, how does it support women living with HIV to take up leadership roles and advocate for their rights? How do you support those women, Flavia?
So thank you very much, and to Uganda Cares for arranging this call. NAFOPHANU is not a purely women's organization. It's a networks of people living with HIV, including women, men, religious leaders, name it, teachers, home-based carers, some are legal, we have musicians. We have a lot of networks who are doing a lot of different interventions to different communities and constituencies. So the role of NAFOPHANU is not to go to the community to implement, but rather to ensure that we advocate for the rights of people living with HIV. And of course, we center the most vulnerable. We are women and girls. So we are represented in various national technical working groups at the Ministry of Health, at the Uganda AIDS Commission, and at global level. And we raise the issues pertinent to people with HIV and lay particular emphasis on women and girls because they are the most affected, infected, and also bearing the burden of the HIV epidemic. We, over the last year, I don't want to go very far. I would like to say that women are a resilient lot. We have been in pain. We were shocked. We were psychologically and emotionally tortured, but we are a resilient lot. We are slowly coming back, albeit the limited resources. We are engaging, trying to hold our leaders accountable to deliver on their mandate. And therefore, we do a lot of follow-up on the quality of services. We do follow-up on stockouts. And as we speak now, NAFOPHANU is conducting, together with School of Public Health, Ministry of Health, UNAIDS, Uganda AIDS Commission, is conducting a stigma, HIV stigma survey to see how much stigma is still in the community, and that should guide our follow-up and also interventions. We have been part of the integration development process. We were in the national advisory technical committees where we engaged, and we were part of the teams that would go to the field to provide mentorships. And NAFOPHANU, together with Uganda Cares, SEHAD, and Uganet, we have been going purposely through a community-led integration mentorships, and we are purposely mentoring the health providers, the leadership about the inclusion of human rights, ensuring person-friendly services, ensuring that there is privacy and confidentiality. And this was a very big issue at the beginning because we were lumped into the general outpatient clinic, and we had issues of packaging. People who were being given big envelopes with tins, others were getting one small envelope with a few tablets, and we had issues of stigma and issues of we have had a significant number of women and girls and other people living with HIV who have been victims of
I think Flavia again is Jimbo. What opportunities exist for young people to learn from women leaders today? How can young people there? Okay, I think she's back. Just a moment.
Okay.
Yes, Flavia.
Yes, I am.
Yes.
Apologies, my network at home, normally in the evenings, it is problematic. I don't know whether it's the waves. So
Yes.
we have been engaging with our community members, our community health workers who are laid off, and with those who are where we still have implementing partners. Our community health workers, the apps, they are still there. They are supporting to follow up, to ensure that people living with HIV access treatment and other related services. We have seen also an increased consideration for space for providing pharmacy services, but also ensuring that in the chronic care clinic, HIV-related stigma, we mentor the providers and re-emphasize the issue of privacy, the issue of support and protection, and the fact that if there is no privacy, we shall see many laws to follow up. And we are seeing increasingly more people living with HIV starting accepting, but we do know that the young people, the key populations, the sex workers, the older persons, the people with disability still find it difficult to be integrated, and therefore there has been thinking that I don't know what to do with this internet tonight. So we are engaging with government to ensure that we are on the radar. And this one is not only for women. I know we are the most affected, but we are also engaged in discussing prevention. The likes of ICW and other young people's groups are fronting the NACAPA they are fronting PrEP. They are looking at persons with disabilities. We are having a myriad of interventions and ensuring that we continue to do our work of treatment literacy and ensure that we provide psychosocial support for those who have a face to lose. And NAFOPHANU has a helpline, a telephone helpline, which has been following up mothers who have been lost to follow up and reintegrating, identifying them and bringing them back to care with their children. We have the likes of Uganda Cares, who is doing a lot of integration mentorships for young people. And we have seen amazing work working with Trevor, working with Jimbo and others. And we have also had engagements and support from Uganet and SEHAD in organizing the district human rights committees, and we were raising issues and mentoring the district leadership about the different difficulties, the legal violations, the gaps in enforcement. And of course, we are trying to engage to see that women and girls living with HIV access the national development programs. We are also engaging with the Ghana AIDS Commission. We are developing national HIV response sustainability framework, and we have been part and parcel of this, and we are trying to make sure that something around social contracting for civil society, and this is not exclusive to women, but all of us who have been working in the communities, doing feminine work that is unpaid and recognized by our very own, but recognized by partners who have realized that care labor, the community health workers who are not necessarily government workers, are purely complementary. They are a public service that have offered self, and we have offered ourselves. We have given to gain. That is our annual, our Women's Day theme. We have given our lives, we have given our houses, we have given our efforts to ensure that we save others. And if you know women, we know when you see someone who is struggling, you bring them in your home, you bring, even now, when we meet those who are struggling, we endeavor to ensure that we link them to services and we engage. And we're trying to engage with government to ensure that resources are allocated to civil society, but also we work with government to link us to the development programs, like the parish development model, like the GROW models. So we are also following the global HIV strategy, which is saying that by 2030, civil society should ideally be working with and within government structures, because I think they anticipated that they would in resources, and therefore we have to have a well-coordinated government-led, community-supported and community-led interventions that are facilitated through government structures as mutual partners, and they also ensure that we are accountable to each.
Jimbo,
Yes,
as
please.
as before I get back to Flavia for more questions, actually more interactions on policies and all that. Let's talk about the mentorship opportunities that exist for young people, those that live with or without HIV. And because I mean, there is a young person there listening in, and they've been waiting for to hear what opportunities they have. Tell us what opportunities young people have when it comes to mentorship, especially from you that is representing them, or that is heading, or that is one on the leadership board of the young people, especially young women listening in right now.
Okay, thank you very much. I like that question because it kind of answers a lot of questions that adolescent girls and young women have. They aspire, they lead in their communities, but then they have a gap in mentorship. They want to learn from the leaders they see. For me, I will start with the opportunities on the ground. We have, first of all, from the Uganda network of young people. It has a lot of organizations or networks in different districts, like I mentioned before, which is a Ginger network of young people, Gulu network, Mbale network, and also Kasese network. So if you are a young person who is looking at joining leadership specifically in this space, you can actually go to those different organizations if they are in your area, reach out to them, talk to them. I know it can be scary at first, but you can find that one person who can listen to you, and you can join through their programs. You will learn about what they do, and also you can connect with a lot of great women out there, starting from the regional networks, but as well from the Girls Act program. The Girls Act program is actually a very well structured program whereby we are not only just an organization in a district. No, we have a lot of chapters in Sentibali Kudembe, Nakawa, Mulago. So if you are a young person and you have AHF Uganda Cares in your district, you can reach out to them and then find out the different chapters in that district. If there is one nearest to your area, you can reach out to the Girls Act leader and find out what they do. You can volunteer to support them, to see what Girls Act is actually all about, learn from them, and even be involved in the activities of AHF Uganda Cares. As well as, if you want to tap into this space in leadership, you can have mentors and reach out to them. I am online on X. You can inbox me. Madam Flavia is also on X. You can inbox her and see how you can have a chat with her so as she mentors you. By the way, from my personal story, Madam Flavia mentored me in this HIV space. I think you remember in the movement of women. the Women at 40, plus Bridget, and also Trevor. So there are a lot of people. So you as a young person, you have to identify them. If it is an organization, reach out to them. If it is a person, inbox them and learn. But as the chairperson of the National AGYW Forum of Uganda, we also have a WhatsApp group where we have a lot of young people with different diversities, those living with HIV, disabilities, key populations. Reach out, be added in the group, opportunities are shared, and you can meet different mentors for you. Thank you. Over to you.
Madam Flavia, uh, uh, I come from the football world. I am an Arsenal supporter in Uganda, was a referee for 10 years. I've interacted with close to 90%. You can unmute yourself. I interact with over 90% of footballers in Uganda. And when you say that your organization brings together all the other HIV organizations in Uganda, I felt as soccer players or footballers, we've been left out. And actually, this is my call now. From here, I want to look out for people in football that are having or that have been affected by HIV, and I want us to come and register under your organization. Make sure we have services. I'm telling you, HIV is moving unscotched when it comes to footballers. These are young people that are known as stars in the whole country who have totally no information about HIV. We should talk about that off the program. My question here is, what are the most effective support structures for families, communities, and organizations that can help women with HIV thrive socially, economically, and emotionally? In about a few minutes as we wind up this discussion.
Is that
Thank you
to
very much.
Flavia or
Flavia.
okay.
Yes.
Over to
Yes.
you.
So thank you so much. And as communities, we all we have a lot of we have support
Yes.
groups of men. We have insurance, community health insurance schemes where people contribute and support each other for treatment or even for livelihoods, for savings, but also for burial. I think we have seen these over the years. We also, as people living with HIV, we have a structure that comes from the community. We refer each other to the facility. At facility, you find some support groups, the community-led drug delivery groups. Then we go to the parish, you have still support groups. And as in NAFOPHANU, we have a sub-county forums, which brings together the different parishes and representatives together, and they form a steering committee that goes to that district. The different sub-counties form a district steering committee, and they have a coordinator. And we work with and directly with all the other structures, the health facilities and the administrative structures of government. And at national level, we engage with Ministry of Health, with AIDS Commission, with Finance, with Parliament, depending on the issue. If it is a service delivery related advocacy issue, yes. If it is money matters, we engage with Ministry of Finance, we engage with the AIDS Commission, Ministry of Health, as well as Parliament. We have oftentimes also gone to the Speaker of Parliament, and some civil societies have engaged with the leader of government business, the Prime Minister. We have also
Okay. Again, that is a technical glitch over there. Jimbo, back to you. How can young women who are not living with HIV contribute to prevention, awareness, and advocacy for those that are affected with HIV? Because I've been part of so many societies that promote healthcare rights for other people. I'm part of the advocacy group for autism. On Sundays, I host these days, the whole of the month of March, I host programs on creating awareness about women living with endometriosis. I'm in the football world trying to advocate for rights of legends, people that played soccer in Uganda for some time. How can young people how can those without HIV actually support those with the virus?
Okay. Thank you very much. So, before I go into the structural ways that they can support, I also want to talk about the individual ways that they can support. The adolescent girls and young women who are not living with HIV can support HIV prevention through learning information, because most cases they seem as if they are on the negative end when it comes to the HIV advocacy, but sometimes it's because they just have the wrong information. So, as an HIV negative adolescent girl and young woman out there, find out the factual information about HIV, but as well as make it your point to share it to everyone, because put it in this way: you didn't know about this information, so someone out there doesn't know about it. You don't need to go onto the YouTube live or maybe X and post, but as well as conversations with your friends. Also, some of these adolescent girls and young women who are HIV negative sit in the leadership positions that actually hold power. I talked about the policies and how they are key in shaping the HIV uh, advocacy for the 42 years that HIV has been in Uganda. So make it your point to make sure that whatever information that you get from the community that you see, even on this live, make sure that it influences the policies in the position that you are actually occupying. But back to the structural ways that they can support. We have girls as leaders in AHF. And just for you to know that GALZAC program is not only for the young people living with HIV. No, as I said, this is a prevention program that is looking at integrating support from the HIV negative young girls and the positive ones to see how we can prevent HIV in the community, fight stigma, prevent teenage pregnancies, but as well as keep a girl child in school. So if GALZAC is in your area, why not join? And also, when you look at the AGYW forum, Bridget can testify that this forum actually started as a group of girls, both negative and positive, having a vision in HIV advocacy. We also later had young people from the different diversities living with disabilities. Now we are into sexual reproductive health and rights. We are into gender and justice. But you can join the forum. You can join the different leadership opportunities and make sure that you join the fight against HIV. As Phile Bongole Lutaya said, today is me, tomorrow is someone else. So we have to join the fight no matter the status that you have right now. Over to you, Mr. Selfcare.
Thank you so much, Jimbo, for that. Flavia, back to you. I want you to finish the point you were previously making. But before you join, I've seen in the comment section a lot of people actually interacting with us. I'm going to come back to all your questions, and our wonderful guests are going to respond to them. And we shall be winding up our program in a few minutes to come. I know I'm going to have these guests back very soon for another extensive discussion on the same topic. This is a health care digital platform. I've seen the executive director of an organization called FAD, FHADI. Please inbox to make sure you have a conversation. We want to inform the public. If you lead an organization and you need space to talk to Ugandans and the world at large, this is why this platform existed. I told you I'm a survivor of COVID-19 patient number 47 in Africa. So this is why this platform, the goal is to make sure the world hears about healthcare. But on Wednesday, it is strict about HIV and AIDS. So Flavia, conclude on what you were saying before you got off the network, and then I'll take you through the next point of discussion. Okay, I think again. Flavia, can you hear me? Okay. As I try to get Flavia back, Jimbo, as we wind up, Can you, in a minute or two, tell us about one of the inspiring stories that you've experienced or had, or
Mm,
personally experienced or heard from a group of young people you've interacted with,
mm.
about how empowerment, or a story that has empowered people or has transformed more young people within your society?
Okay. Thank you very much. Let me see if the mic is on. Okay.
Yeah.
So, a story of change that actually caught my attention is
Mm,
one of Madame Flavia, who is
mm,
right now on air with us,
yes.
where she was just a patient, not knowing whether she will survive the
Mm,
next day,
mm,
joined trials because that was the option there. You had to join so as you have to, to get those tablets that uh, the Europeans are sending in bulk. So it was really so sad that even the
mm,
medicine was in fridges. So if you don't have
mm,
a fridge, you are lost. You get
mm,
it was
yes.
something that is really so devastating. And
Mm,
how she is now a global leader and an inspiration in the
mm,
HIV movement and sexual reproductive health and rights is a
mm,
story to look back to as a young woman out there, whether HIV positive or not. It is just to show you that all these challenges that you are facing, yes,
mm,
it is your identity. You are a young woman who
mm,
is not economically well.
mm,
Yes, you are a young woman who is living with HIV. Yes, you are a young woman facing based violence by your uncle,
mm,
by your brother. You're facing oppression. But then, how
mm,
can you turn what you are facing into an opportunity to liberate yourself into a leader, but as well impact to the community? If you are
mm,
facing gender based violence, why don't you stand up against it? Advocate, become a leader, and
mm,
also impact and create awareness for the rest of the community, because leaders like Flavia are the reason as to why right now we are having treatment that we are having. Yes, regimens have changed over the years, but
mm,
then the blueprint was because someone came out and said, this is the challenge I'm facing. How can I
mm,
turn it into something transformable? Because as women in this month,
mm,
we have to understand that challenges will always be there. You get things will not
mm,
be always smooth. We are always going to face challenges, but then what are you going to do about it? Over to you,
mm.
Mr. Selfcare.
Thank you so much again, Jimbo, for clarity and all that. What do you think? What's the role of partnerships, Jimbo, between organization, government, community leaders in this struggle that we have to end HIV by 2030, in your perspective as a young leader?
Oh my God, this is something that is magic,
Mm,
because we have been with HIV in Uganda and all these
mm,
challenges for over, I think, if I'm not wrong, HIV has been in Uganda for now 43 years.
mm,
Yes, it is 43 years by 2026. And we are
mm,
having this challenge over and over. But I realized that the key to
mm,
ending HIV and these challenges is bridging the gap between policy,
mm,
science, and community. And that is where now collaboration comes from. If we are able
mm,
to work well with the government, we shall have responsive policies that actually work for the challenges and realities that young people actually face, that the community actually faces. And if we are having collaboration with
mm,
the government, and together with the researchers in the private sector, we can have research that works. We can have funding for that research to make sure that we get the cure, because the
mm,
cure research is ongoing. But then when you find out from the researchers at JCRC, they say because of funding, but then
mm,
local funding is there for a reason. So if we have a bridge between the
mm,
government, between the private sector, we can have
mm,
that connected. And if we have that, and we
mm,
work well with the community leaders, with the Girls Act leaders who do all this advocacy, community mobilization, Miss
mm,
Y Plus, we work with the
mm,
AGYW young people and all these viewers who are now going to
Yeah.
join the advocacy,
Mm.
you see that the connection between policy, science, and community is now clear. The policies will work for the people, they work for the researchers. We shall have science that is working. We shall also have people actually participating in these clinical trials, because
Mm.
yes, the funding can be there because the policies are working, but then people are not there to join the community trials, the clinical research trials, to make sure that the science is actually working for everyone. So I see that this collaboration and partnership is the magic bullet that everyone has to take. If everyone says, me, I'm in the civil society, me, I'm the government, I'm having the funds, I'm global fund, me, I'm a Girls Act leader, I know my leaders very well, we shall not have any change. HIV will now take another 44 years. That's my um, take on that. Over to you, Mr. Selfcare.
Okay. Yes, Flavia, can you hear me? Flavia, can you hear me? Beautiful. I'm glad to have you back, Flavia. Again, it's not about you, it's about the network. I think where you are. Can you hear me now? Flavia, can you hear me? Okay. Flavia, can you hear me? Flavia, I think you're muted from your side. Can you hear me? Wow. Um, okay. Flavia is disturbed by the network. It's unfortunate that we cannot get her well, but yeah, next time I think we shall have we shall host Flavia back here for another discussion if I can't have her on. Again, what, Jimbo, what are your closing remarks?
For me, my closing remarks are about the challenges, because
Yes.
many times we celebrate the Women's Month. We have
Mm,
all these podcasts about empowerment,
mm,
and we forget that the challenges are still there. I recently saw on TikTok that people were celebrating mothers, were celebrating leaders, and office people, lawyers who are women. But then
mm,
we forget to celebrate the challenges that these women face, like gender-based violence. So we have gaps like information, where many young people, for example, those living with HIV. Let me tell
mm,
you something. Me, I got to know that HIV can be transmitted from mother to child after
mm,
me entering the space. And
mm,
I have been studying. So, what about that one young woman who is out there in the community and they do not know
mm,
this? But ideally, it is the same other young woman who has not been linked yet to the facility to get treatment. So, you see how young babies keep on getting infected. So, as the community, we have to bridge the gap in information. We
mm,
have to work on the power dynamics, because even though we give information to these women and girls,
mm,
if the power dynamics are still there, they will
mm,
not go for these services. They will not go for the PEP and the Lena Kapaville, because the man has said so. We
mm,
shall not see them going for these services because the community leader is saying those people will kill you. The religious leader is saying condoms are bad, but the
mm,
services are there. We
mm,
have bridged everything from policy to science to community. So we have to remind ourselves that as we advocate, as we create information,
mm,
there are still these barriers in economics, in exclusion. For example,
mm,
young people living with disabilities, they can have this information, but because they can't see, they will not be on this X space to
mm,
see, on this YouTube channel to see and also hear what I'm saying. So we have to stay reminded on the challenges, but again, be reminded of the solutions that can help us help these young women realize all their dreams, like comprehensive sexuality education. If the government can help us have sexuality education in the schools, we can prevent a lot of young children getting HIV in schools. Picture this: a young woman who is positive, okay,
Mm,
they take all the treatment, the child is negative, and on growing up in high school, the child gets positive. It is
mm,
so sad. And it is just because the government is not allowing sexuality education to make this young girl or boy know that having sex in school is bad, or maybe you can use a condom. Because also, however much we prevent these girls from having sex, the fact will be there that they are having sex. But what can we do? We can preach on it, but if it fails, what can they do? So the challenges are there. Let us not forget them. The barriers are there, but also what can we do about whatever is happening? Thank you, Mr. Selfcare.
okay, Flavia, can you hear me now? Okay, as we wait for Flavia to connect, I have a few questions from the comment section. And again, I want to thank all colleagues that have sent us questions in the comment section. Thank you so much. Pius is saying he's already here. Thank you so much, Pius. Jean John, can we come up with a clear guideline for saloon operators, tight monitoring framework? I think he's talking about, have you understood that question?
I think he's talking about guidelines on the
Mm,
saloon operators, because ideally they
mm,
use machines, and there is also a lot of a risk in there. So maybe
mm,
he's talking about that challenge of maybe sterilization.
mm.
That is what I'm getting from that question. But
Oh,
this goes
mm,
back to the policies that we have. I
mm,
think with good advocacy and also commitment, and him coming to the forefront, linking up with me and Flavia and AHF, we can actually have a conversation. You know, we have all these challenges and ideas of solutions, but if
mm,
they don't reach the decision making tables, that's where now the problem comes in. This is an issue that people have been having in the community, but it's a
mm,
matter of us presenting our complaint, for example, to the Uganda AIDS Commission or the AIDS Control Program in the Ministry of Health, and also with evidence, for example, from community people who have faced such issues here and there without proper monitoring and a tracking of such cases. That is my idea on that. Maybe
thank,
Flavia can elaborate more.
thank you so much. Maureen is saying we are waiting. Thank you, Maureen, for tuning in. Pius, thank you so much, Pius. Nalvega Flavia is tuned in. Phoebe saying, interesting conversation. Yeah, it's been good. Someone is saying, hey, Jimbo, this is Peter Malida, the older from Katente. Jimbo, I should take you to my home village in Katente and see if we need to create something there. I mean, I wish all the best things for I'm a village boy born in Ikatente, so I wish everything good to go. So I know soon I should take AHF Uganda together with Jimbo, Flavia, and all the other people to Katente to increase sensitization. I mean, I'm their village boy, okay? So I wish them all the best. So someone is saying, I'm surprised the government is not helping in HIV responses regarding treatment. All the same, thank you for the discussion. Yes, again, we are not saying government is not helping. It is the rate, what we think, what should be done versus what is being done, especially in this space where HIV funding has been cut short by some of the funders globally. This is again Joy saying, wish you all the best in the discussion. Thank you so much, Joy, for being part of this. This is Komugisha Sarah. Thanks Jimbo, for the good work. Yeah, thank you so
Thank
much
you.
for watching with us. Francis, thank you so much for the discussion platforms. And I wish this is extended to the stubborn men. Yes, we are trying to get men on board. That's why AHF Uganda, among other stakeholders, are now getting into the men sport. Right now, AHF Uganda is the leading sponsor of the Uganda's most prestigious football awards called Local Football Appreciation Awards. And AHF is there pushing the message. And I want to invite you, Jimbo, to be part of AHF Local Football Appreciation Awards. I'll talk to the organizers to send you an invite. I want to see you there. I want you I kind of ask you to come and give a speech. I want you to talk to the young people because we have women in sport that are comprising of close to 40%. I mean, this is going to be a function where I think we should continue this conversation. We are not leaving any stone unturned when it comes to HIV, and I want to thank AHF for making this actually possible.
Okay.
Someone is saying, can we come? Okay, I think I read this. This is, I think, Simon Ayevale, Executive Director, FHDI. Simon, I would love to have a discussion with your organization. Please inbox me or write to me at chimboa80@gmail.com for a conversation. This is Kama Leadership Academy. Thanks so much for watching with me. This is very important. I wish I knew about this program every Wednesday. Clear information given out. Thank you so much for watching with us. Again, okay, again, Kama is saying, let's share this with all our friend groups and social groups. Yes, this is very important. Each time you share, you're carrying this message beyond your walls. Francis Otuke saying, as we advocate, let's look at SPAs and massage paras. Members, please, these girls and women are dangerously exposed. And if we don't stand in the gap, the next prevalence will show. I totally agree.
True.
I
Mm.
totally agree. Flavia, as we wind up, and again, one of my personal persons here, Letitia, saying, giving a high five. Thank you so much, Leti, for watching with us. Flavia, Jimbo, as you conclude, one word, what would you say to places called massage paras?
Pardon?
Because what's your comment on this? Are people working in these spas and massage paras?
Mm.
Because now it seems
Okay.
to be a hub of
Mm.
HIV. There is, I think, a study that was done in Western Uganda, even if I'm not mistaken. I read about when the president was almost directing for closure almost on these paras and actually putting strict restriction. There are
Mm.
disturbing images recently of a massage para that opened in Nantinda, one that is operated by a famous TikToker or YouTuber who has name of a certain bird. By doubling it is called something something, same names repeating twice. And I mean, when they were launching this massage para, it was like they were launching something that was almost exposing young girls dressed indecently and doing so many things that I felt were important. What's your take on that in a minute as we conclude the show? Risky
Okay.
behavior, girls working in risky behavior places.
Okay, so thank you so much for that. Places where girls are working in risky behaviors have always been overlooked,
Mm,
especially when it comes to response programs, when it comes to justice, and when it comes to action, which is
mm,
also the international theme for the Women's Day, which is justice and action. But we have to make sure that the government is aware of such acts, because us coming on social media and talking about it is part of advocacy and activism. But if we can come together to record such cases on paper and take them to the Uganda AIDS Commission or the Ministry of Health AIDS Control Program, we can have a way forward with especially their legal team to see the loopholes in such activities, but also taking it back to the prevalences that still show. Many young women will still work in such areas even if they are closed. They will work there if it is illegal or whether it is not illegal. But what we have to do is a gender transformative approach, which involves touching all the barriers or all the structures that create an environment that forces this particular adolescent girl or young woman to work in such an area, including education. The government cannot just come and close such areas. The young girl will tell you, this is where I get the money that I earn. I'm not at risk. Because they do not have education, they are not employed. This is where they earn what? Their money. But if the government can come up and scale up education in for adolescent girls and young women, we can have a change in such acts that bring the prevalence up of HIV, but as well as doing mindset change and value addition. If some of these people do not know the risks that come with working in the spa. Do you know that people these days think sex is a normal issue? But then, if we can break down the issues that come with unprotected sex, but as well as instill confidence among these adolescent girls and young women, because some of them they do not even like the work that they do. But just because they are coerced by the friend, come here, we work, there is this celebrity, we are going to see rich people. If we make these girls understand the power of being confident and assertive, you will not see any girl working there because they will be confident that I cannot work and I'm saying no. Even if you coerce them into working, they will stay assertive. And as well as if we have government support on the different issues that, on the different structures that make them vulnerable, for example, education and employment, which girl will go back to that spa? There will not be anyone. And if you also have policies in action, the bad thing that we have in our country is that policy only works for the rich, which is the fact that I will not fear to say here. But if we have a justice system that works for everyone, especially not looking at power dynamics in gender, when a woman reports, they say, why are you reporting? This is what you people want. But that is not what people want. They are being violated and they are coming out to get help. How do you tell them that just because they are a woman, they asked for it? If we can have response between the government and the community and us from the civil society, different young people will come up with such testimonies, because in the forum I have seen many young people talking about it, but they have not been given platform because the system is not responsive. But if we can work together, I believe that we can make this happen through advocacy or even activism if there need be.
Wow. Thank you so much, Jimbo. It's
Thank you.
been a pleasure and honor to have you here.
Me
I
too.
believe my listeners have been transformed, inspired, and actually encouraged by how strong you are and the message you've put out there. As a host, I want to thank you for being a part of this. But as we conclude today's discussion on women and HIV in Uganda, we've looked at empowerment, we've looked at support, and we are reminded that actually women are at the heart of Uganda's response when it comes to HIV. Women living with HIV face unique challenges, and yet they continue to lead, inspire, and transform their communities, like we've heard today. Equally, women not affected by HIV play a critical role when it comes to advocacy, when it comes to mentorship, and actual leadership. We've seen different women in this space, ranging from powerful officers speaking about HIV, ensuring prevention, education, empowerment to reach out every corner of our society. We are deeply grateful for our guest today, that is Mr. Chomukama Flavia and Jimbo Shanura, for sharing your insight, story, strategy to empower women across Uganda. Today's conversation reminds us of simple but powerful principles that when we give support, when we give guidance and opportunities to women, the whole community actually gains. Let us continue to break stigma. Let's continue investing in women leadership and support women living with and without HIV. I'm telling you, together we can create a healthier, stronger, and more empowered Uganda. Again, I want to thank everyone that joined in today for the discussion. Let's keep the discussion going on in the comment section. It's unfortunate that we lost Flavia on the way, but I promise you we are going to have Flavia come along here, the next time, and we have an insight on her role, and we finish up this conversation. And remember, empowered women equals to empowered community. I want to thank you for being with us today. My name is Mr. Selfcare, your host and CEO of Mr. Selfcare Initiative Global. Today we had the program live from our studios in the US. Stay safe, take care. The goal of 2030 is still possible if you and I stand up to take charge. Men, I implore you to take charge. Thank you so much, and have yourself a blessed night. May God bless you all men as you go to watch Arsenal defeat Bayern Leverkusen tonight. Bye.
Bye.
Owaaye obadde okimanyi tosobola okukeberwa n'okujjanjabibwa endwadde z'ekikaba ku bwereere wano Kalungu Wellness Center. Obulidde bulungi, basobola okukebera n'okujjanjaba endwadde z'ekikaba ku bwereere. Jjangu nange nkulage wekiri ekyangu nga waakatuuka osookera wano ku reception n'oyingira n'otuula ne weewandiisa. Tulina abasawo baffe abalungi abakwaniriza n'omukwano omungi nga gw'olina kola kimu kyakukkakkana n'olinda kye bagamba ekiddamu. Weetaaga omuntu w'okwogera naye. Tulina bakansala baffe abalungi abajja okuwuliriza ate tebajja kusalira musango gwonna. N'ekirala bijja kuba byasamba okumanya embeera y'omubiri gwo. Oli mu bwanvu kyenkana ki? Ozitibwa kyenkana ki? Byonna babikola mu bwangu ate nga tebiruma. Ng'otuuse okwekebeza akawuka akaleeta mukenenya n'endwadde ez'obukaba zonna bikolebwa wano ate bayita mu bwangu nga tebirudde nawo. Ate bw'oba weetaaga obujjanjabi, abasawo baffe bakuwa obujjanjabi obusinga nga bamaze okukebera ate ku bwereere. Kya bwereere ate nga bakola na mukwano. Tambula yadde okuswala kwonna wano Kalungu Wellness Center. Mujje babajjanjabi.
Tuyitibwa Kalungu Wellness Center.